Hello, dear students and learners. Montech Medical Minds wishes you a happy learning and great success. Enjoy the session and bring your friends to learn through our trainings. Let's welcome our speaker to continue the session. Over to the speaker.
ICD-10-CM coding of diabetes mellitus. Diabetes happens when your body isn't able to take up sugar, glucose, into its cells and use it for energy. This results in a buildup of extra sugar in your bloodstream. Mismanagement of diabetes can lead to serious consequences, causing damage to a wide range of your body's organs and tissues, including your heart, kidneys, eyes, and nerves. Diabetes ICD-10-CM code categories. E08 diabetes mellitus due to underlying condition. E09 drug or chemical induced diabetes mellitus. E10 type 1 diabetes mellitus. E11 type 2 diabetes mellitus. E13 other specified diabetes mellitus. Let's discuss the above categories in detail. E08 diabetes mellitus due to underlying condition. This is also called as secondary diabetes. Diabetes develops due to underlying condition or etiology or a primary cause. These underlying conditions are as below: congenital rubella, Cushing's syndrome, cystic fibrosis, malignant neoplasm, malnutrition, pancreatitis and other diseases of the pancreas. Assign E08 category of ICD-10-CM code for secondary diabetes due to underlying condition. Sequencing of secondary diabetes E08. Follow the instructional guideline given at the category E08 code first underlying condition. Sequence the code for underlying condition as primary or principal diagnosis followed by secondary diabetes E08. For example, a 35-year-old male patient diagnosed as diabetes due to cystic fibrosis. Assign a code for cystic fibrosis E84.8 as a primary diagnosis followed by E08.9. E09 drug or chemical induced diabetes mellitus. Assign category E09 for diabetes develops due to drugs or chemicals. Follow the instructional guideline at category E09 code first poisoning or use additional code for adverse effect followed by E09. Sequencing of E09 is whether poisoning or adverse effect. If diabetes due to poisoning, then code first poisoning followed by E09 category. If diabetes due to adverse effect, then code E09 category with any complication, if any, as primary followed by an adverse effect. Example 1. A 56-year-old female diagnosed as diabetes due to accidental poisoning of acetaminophen. Assign a code T39.1X1A as a primary code followed by E09 category with any complication, if any. Example 2. A 56-year-old female diagnosed as diabetes due to an adverse effect of acetaminophen. Assign a code E09 category with any complication, if any, as a primary followed by T39.1X5A. E10 type 1 diabetes mellitus. Your body attacks the cells in your pancreas, which means it cannot make any insulin. E11 type 2 diabetes mellitus. Your body is unable to make enough insulin, or the insulin you do make doesn't work properly. Assignment of codes for type 1 and type 2 diabetes based on the physician documentation and any complications, if any. E13 Other specified diabetes mellitus. Assign category E13 if diabetes due to following: diabetes mellitus due to genetic defects of beta cell function, diabetes mellitus due to genetic defects in insulin action, post-pancreatectomy diabetes mellitus, post-procedural diabetes mellitus. Diabetic complications or manifestations. Mismanagement of diabetes can lead to serious consequences. Diabetes-related complications including cardiovascular disease, kidney disease, neuropathy, blindness, and lower extremity amputation are a significant cause of increased morbidity and mortality among people with diabetes. Diabetes complications or manifestations are categorized as below, indicating with fourth-digit character in each category of diabetes codes, such as hyperosmolarity, ketoacidosis, kidney complications, ophthalmic complications, neurological complications, circulatory complications, other specified complications, unspecified complications, without complications. Coding note: if type of diabetes is not indicated or not documented by the physician, consider the diabetes as type 2 and assign type 2 diabetes codes. Alphabetic index of diabetes is used with main term diabetes or diabetic, and all the associated complications or manifestations are given with a subterm with E11 category main term diabetes or diabetic and subterm with E09 category main term diabetes or diabetic and subterm due to drug or chemical, followed by subterm with E08 category main term diabetes or diabetic and subterm due to underlying condition, followed by subterm with E13 category main term diabetes or diabetic and subterm specified type NEC, followed by subterm with E10 category main term diabetes or diabetic and subterm type 1, followed by subterm with. This is the end of this session. Thank you for joining the session. Follow us in YouTube for listen this topic again. We will come back with part 2 continuation of diabetes topic classification and coding of ICD-10-CM diabetes manifestations or complications in detailed. Contact us for joining our medical coding and clinical documentation programs, and follow us on Facebook, Instagram and YouTube.